Hi again, everybody. This is Dr. Langlois with the Pet Pantry of Lancaster County, and of course, we are not doing a heck of a lot so long as these non-elective surgery procedure orders remain in effect. Obviously, it has been affecting our ability to do spays and neuters, but we are doing, of course, seeing urgent cases and different cases here and there as they come through. And so we had an interesting one this morning that a lot of people don't get to see too often. So we did want to kind of show it to you, and it involves what we have here, which is our cute little polyp friend. And this just came out of a kitty, and I'm going to show you that in a second. But it is something that we do see sometimes in cats that seem to have chronic upper respiratory infections that don't seem to go away. They seem to get a little bit better with antibiotics and then come back a little bit. It usually happens in younger cats in like the 6-month to maybe 2-year-old range. And this little guy certainly fit the bill as far as all of that goes. So let's go ahead and take a look right now at something that will be making this cat breathe a heck of a lot easier as soon as he wakes up. So in our buddy here, these polyps, they actually decide to kind of grow up through kind of the eustachian tube areas, things like that, and they will actually sit kind of in an area that's behind the nasal cavities and basically just above what we call the soft palate. And the soft palate is a fleshy little red bit of tissue that you're going to see us attempt to pull forward here. And because of where this polyp sits and grows, obviously it prevents normal airflow when the cat breathes in through its nose, so you get this kind of stridorous, sniffly, snarfly noise every time they breathe in. Now you're going to see us, we're going to pull the soft palate forward a little bit. You're going to see a little nerve reaction there with the tongue. That's normal. This cat is under full anesthesia, not feeling any of this or anything like that. And you can see a little blib of the polyp right there. And we don't have the greatest angle just yet, so we're going to try to reposition a little bit here. These can be difficult to initially visualize, but once we get a good visual of them, they're pretty easy to grab and pull out, as you'll see. So we're going to first try to see if we can grab it right here. Not going to be able to get the best feel of it. So we're going to reposition a little bit with our spay hook to pull a little bit more forward. There we go. And now you can see our big friend sitting right there. And so we're going to clamp down with just a little bit of a hemostat there. And basically, all the rest we do is we just pull, and we're just pulling these things off the stalk that they grow from, and you'll see it'll start to get bigger and bigger as we pull things out. Just about out now. A little bit of a wiggle. And there we go. It's a boy. Well, I think it's a boy. I don't know. But you can see, just a fleshy mass. It's not cancerous, as far as a malignancy or anything like that. It's just this benign tissue that continues to grow and eventually would cause major, major breathing problems if we did not take it out. So you'll see what we'll do here. There is obviously a little bit of bleeding from this because you are just kind of pulling this off the stalk. So we are going to go ahead and just put some gauze back there to sop up the blood and just to stimulate a little bit of clotting. And he is good to go. Pretty cool, huh? Yeah, we don't get to see that too often. I maybe have done only about 10 or 15 polyp removals in the 15 years I've been a vet right now. But it is something that's really neat. It's something that we feel really good about because we can actually provide almost instant relief to those cats when they wake up. So it is something, for you and your vet to think about if you do have a younger cat that seems to be getting these chronic upper respiratory infections, maybe with some discharge from the nose. Usually a tip-off is that they have trouble breathing through their nose, especially on the inhale. So they sound very stridorous or sniffly when they're trying to breathe in, and that continuously gets slowly, progressively worse over time despite antibiotics and things like that. So then a polyp is certainly something that your veterinarian can look for. Again, they do require obviously to be under anesthesia when we do it, but it is something that does provide immediate relief. There is always a slight chance that they could come back. They do also have the potential to grow out through the ears as well. So some people may be familiar with ear polyps in cats. There is a surgery, obviously, where you go into an area called the bulla, which is right at the back of the base of the skull, and you go in and you kind of grind all that material that's in there out. That's really a 100% way to guarantee that they never come back. That's out of the realm of my expertise or equipment, obviously, but some veterinary surgeons still do that. So again, if it is something that you might be questionable about, or a cat that just doesn't seem to be recovering as well from upper respiratories or gets better on antibiotics and then when you take them off seems to be getting worse again, talk to your vet about a possible polyp. It is something that's kind of neat, kind of cute, and as I said, provides very instant relief. So hopefully we'll be back soon bringing you some more interesting stuff to keep you entertained during this quarantine lockdown.